All right, guys, I'm here again, Dr. Mirza, talking about another device review, and today we're going to be reviewing the Paragon 28 ankle fracture system. It is also called the Gorilla Fracture Plating System. Great name. Let's talk about the device. Just a bit of an overview. Paragon 28 is specifically in the foot and ankle space. There's some nice features I like about it when I've used it, and I'm here to talk to you about it, and let's go over it now. Like any device, there's some common instruments and systems and plates that are available. You've got your ratcheting screwdriver, you've got your guides. It does have a variable angle pitch that you can use to place your screw. Now, different devices have different angles that you can use. Some go as high as 20 or 30 degrees. This one goes to 15 degrees. So you can see here in this specific cone, it allows you to place a drill or guide wire anywhere within that conical cylinder to allow you up to 15-degree angle within the plate. So in action, you apply the plate here, and your wire can go within that conical cylinder, and that gives you that 15 degrees. So now that's becoming much more common now within many fracture plating systems, but I do want to highlight one very cool feature that I like in this plate. If you look at it closely, it's very thin. And again, pre-contoured plates are coming very much into vogue, and they've been coming into vogue for quite some time. But you look at how thin that plate is, and when it comes to older patients, thin-skinned patients, patients with prominent bony landmarks, or in typically most ankle cases, you want as thin a profile as you can. And what this allows you to do, it has the structure rigidity of titanium, but relatively thin, pre-contoured, and smooth on the edges. So there's no sharp edges on the ends. And I find that's really important with any fracture plating system, and it's always been one of the criticisms I've had in the original fracture plating systems is you get an older patient, and certainly for women, and I think this is sometimes where gender-specific issues come up. For women that, for shoe wear, for heels, for showing their ankles, for being able to fit certain types of boots and shoe wear, it becomes more important. Not to say that men aren't particular about their shoes, but in my patient population and in the patients I've treated over many years, there is a gender-specific need for women to want certain types of implants that accommodate their needs. And I think it's important. I mean, we have to be cognizant of every patient-specific option that's out there. And that's why one of the things I like most about this plate is how thin this is. Okay? And there's a number of different plate options which I do like, and sometimes you have fracture patterns that you need to go a little bit longer, a little bit shorter, a little bit wider. Sometimes you need a hook plate, and they have a hook plate. And so the hook plate basically allows you to capture a fragment, and what I'm going to do is show it on this model right here. So it allows you to capture the fragment and suck it in. And when you do that, there's a guide that you can use to either push it in as well as drill right through that hole. And that allows you to not only get compression pushing the plate in with the hooks lodging in, but you can also get some compression and stability longitudinally, and therefore you have polyaxial stability. So you get a longitudinal screw plus an orthogonal screws in variable pitch angles, and that allows you to get really good structural stability in a complex fracture. You probably won't use this in all your fractures, but sometimes where you have significant comminution or a distal fragment as well as proximal comminution, you may find this very useful. Okay? And there also are some different types of plates for the lateral side, posterolateral. Okay? You have a medial plate and this gives you a number of different options. It's broad, it gives you some options. There's different length and configurations for this. There's a medial hook plate as well, and this allows you to really capture the fragment again. The hook really allows you to come on. I'm going to show this to you here, where you can apply it with the fragment and you place it in, and it basically, you tap it into place where you want. You can put the device on to push as well as drill directly up if you need it, and therefore it gives you the advantage of construct stability when you do this type of approach. You may not always need this extra screw, but the hook plate allows you to get very distal fragments without actually needing to disrupt the ligaments that are there. So sometimes you may just use the hook plate without having to put a screw, and that gives you good stability. Another medial plate configuration that exists. What I also want to show you is this structure here. So it's also available in a straight plate, but I'm showing the different screws because in these different screws you have different sizes, and they're all color-coded. I love color, you guys know that. And when it comes to ease of use for the technical scrub, the nurse, your assistant, whether it's a PA, nurse practitioner, who's ever helping you, it allows that assistant who's handing you the devices and the instruments and the screws, or even helping you during the case, it's color-coded. And they're available in different sizes. So you have the 2.7, 3.5, and 4.2 screws available, different sizes, and they all fit in any of the plates that are available in this Gorilla system. And that's a nice thing. And these screws are called monster screws. So I think it's partly marketing, but it's a cool name with a cool device system. And I think having color-coded screws relative to the plates makes it easy to use, because then I'm not handed a screw where I have to question, hey, wait, this looks like a 3.5. Is it a 3.5 or a 2.7? Because when you're getting a case done, you don't want to be futzing around with whether you have the right screw or not. You want it quick, seamless, and just straightforward in terms of instrument passing, and that's what makes this useful as well. The other feature that I like is this type of screw. So this is a locking screw. So I know I've talked about locking and non-locking plates before, so I'm going to use the Paragon 28 system that I have here to just go over what's the difference between locking and non-locking. Now, a lot of times in young, healthy bone, we don't have many issues. We use non-locking screws. The bone quality and the bone strength and the density is relatively strong. You can get a good bite and a purchase. It's kind of like the difference between putting it in fresh wood, putting a screw in, versus dry, old wood where you just can't get a purchase. And that can be difficult. You know, if you have termite-ridden bone or old wood, you just don't have a purchase, and so you're not going to get any suck down on any system plate that you're placing onto bone, or in the case of the construction example, onto wood. So what is the difference between the locking and the non-locking screws? So what we have here is we have a non-locking screw and a locking screw. And they're color-coded differently, so you can differentiate the two. You can also see, as I described before, there's a threaded pitch on a conical head on the locking screw. And the head is such that you can actually, it comes flush with the plate once it's down. So that means it feels like a headless screw. And sometimes I may actually call it a headless screw because it doesn't stick out. It's not like traditional screws you'll get in Home Depot or hardware stores that have a rounded head on top that's prominent. In the non-locking screw, it's just a traditional head. It doesn't have the conical taper. It still has the double helix thread on it so you can get some compression, but it doesn't lock onto the plate. What does that mean? So here you have a screwdriver attached to this, and it's a hex style device. So it sits pretty good. It's not going to fall off. The other thing I might as well mention is that the Paragon 28 does have a nice ergonomic system. You can switch forward and reverse, which is nice. So it's ratcheting, okay? That's a nice feature, and you can go backwards or forwards depending on which way you want to go, okay? So when you put the screw in, the traditional screw will go in, but once you put it out, it's not like it's locked onto the system. So if you leave it and it's not screwed on, it's going to fall off. The difference with the locking screw is when you have this, once you put it in there and you try and compress it in, it actually locks onto the plate. Now, I'm not locking it fully because this is a system we're using for a trial, but it essentially allows you to lock that onto the plate. And what does that mean? So that means that I've created almost a rigid fixation system where we have a plate where the head is locked in, and you have a rigid, now that you based on even variable angle, once it's set, it's locked into place, and it won't move or loosen for the most part, just based on the construct. So that's the difference between locking and non-locking. In all of their screws, in the plate screws, they have the recon screws, they have a double helix. And what that allows you to do is it allows it to screw in at a faster rate. But the other advantage is, and this is going to fall into our coolest feature of the month, that'll be covered in a separate segment that we'll do at the end of the year. And what that is you can actually compress the plate to the bone before the screw locks into the plate. And that, to me, is a really big advantage. Then I don't have to compress and then change it out to a locking later, or sometimes some systems have screws that you can actually put in and compress and then lock them afterwards. This is all in one device, and that's why this is the coolest feature of the month. And we're going to cover this again because I really like this feature. And when you use it in the OR, it just saves time and it just works really well. So I like this. And that's why I wanted to cover this specifically. The other thing I want to go over are the headless screws. Now, headless screws are available and they're cannulated, okay? So what that allows you to do is place a guide wire in place first. So if you have a fracture pattern, and say you're just doing the medial malleolus, you'll put your guide wire in place first, and then after your guide wire is in place, you follow it with a screw. Now, sometimes in ankle fractures, you don't want a prominent head. So as you put this screw in, you want this head to simply disappear. So I'm actually putting it behind just so you can see. But then that way, once it's in, it's completely buried. And that's the beauty of a headless screws compression system that comes with a fracture plating system. And I definitely like having that option available. They're available in 2 different sizes and they're color coded. So that's another nice feature that is useful in this particular system. And so essentially, that's the bulk of the fracture system. And sometimes with ankle fractures, we also have a syndesmosis injury. And a syndesmosis injury, as many of you knew, is a disruption between the fibula and the distal tibia. So if you have that disruption, oftentimes you not just have to plate the fibula, you have to place some type of a syndesmosis repair system. Now, traditionally, a screw was used, but when you use a screw, they sometimes break, or you remove it, or they remove before you break. They break before you remove them, and then you have to decide: do you leave it or do you take it out? So, one of the things that Paragon has come up with is a syndesmosis screw, and in this particular case, there's different sizes. There's 2 sizes available in terms of the length of the screw within the relative to the syndesmosis, and this allows it to actually break over a period of time. And if it breaks, you still have the option, because this screw removal system will actually lock onto this hex system here. So when it breaks at this point, you can always go in and remove it. However, there's also a system to remove the screw from the other side. So it's all part of the system. You don't necessarily need, I would always have it available to have a dedicated screw removal system that's more universal, but having that all available to you by the same system just makes it seamless. It's less thinking. And of course we think as surgeons, of course we do things, but when everything is all incorporated within the same system, you have a comfort and ease that, hey, if I run into any issues, I'm covered. I've got the system I need because it's already available from the system. So that's another cool feature I like that's available within the Syndesmosis. However, personally, my tool of choice for syndesmosis repair are actually some of the non-metallic rope or suture type of systems and threaded buttons, but having this as an option is really useful within any ankle fracture plating system. So that, in summary, is what the Paragon 28 system offers. It offers you a number of features, and the ones I like the most are really thin, smooth-edged plates. We talked about the really slick, coolest feature of the month, which is the headless screws that allow you to compress the plate to the bone. And then you have the host of other features that we talked about, from the different sizes that can fit in the same plate to the headless screws. And then you have a full gamut of instrumentation systems and color coding that goes along with the system. So that, in a nutshell, is the Paragon 28 Gorilla Fracture Plating System for ankles, and I hope you enjoyed it, and this is a thumbs up from OrthoSynthesis.